Good morning and welcome to today's Return to Campus conversation. I'm Sharon Martin, Vice President of University Relations and Enrollment Management. On Wednesday, the university announced that we would be returning to in-person instruction beginning Monday, September 28th. Today's conversation will address issues specific to faculty. Today, we are going to walk through the data that helped form that decision, as well as how the university will transition back to the on-campus experience. To help lead our discussion today, we have four senior leaders with us. Joining me are Rob Alsop, Vice President for Strategic Initiatives, Mary Ann Reed, Provost and Vice President for Academic Affairs, Corey Ferris, our Dean of Students, and Dr. Jeff Coben, Associate Vice President for Health Affairs and Dean of the School of Public Health. We will follow our typical campus conversation format today. We will share a brief presentation, and then we will move to questions and answers. We are using the Zoom webinar platform for today's discussion. And before we begin the presentation, let's run through those features that will help you experience today's conversation in the best way possible. To view closed captions or subtitles, click on the CC button found in the bar at the bottom of your screen. If you have questions, use the Q&A function also found at the bottom of your screen. To further secure our conversation today, participants will only be able to see questions that are answered by our moderators. To ask a question, just click on the Q&A button and a separate screen will appear, and that is where you can type your question. Please note that many questions will be answered live as we review the materials. Therefore, we will not be answering any questions until after the presentation. If you have any issues with audio or video at any point during today's conversation, be sure to check your personal Zoom settings. And if the issues continue, you can email us at campusconversations@mail.wvu.edu. We'll be monitoring this feed throughout the presentation and can help as needed. We'll answer as many questions as we can live following the presentation, and our moderators will also answer your questions via typed response in the Q&A. So that takes care of all the housekeeping items. It's time to start the conversation, so we'll turn it over to Rob to begin the presentation.
Good morning, everyone. Before we get started, I want to just give a word of thanks for all of the efforts of our faculty and grad students. As a two-time grad of this institution, I can still remember walking into my first day of classes with Professor Prentice with Classics 101 in Chitwood Hall, to my work studying and learning about the American presidency with Dr. DeClerico, to all of my faculty at the law school, from Professor Carty to Professor Ashdown, to everyone who made a big difference in my life. And just know that while this pandemic is hard, you're making a huge difference, just like this institution made on who I am. And so I in particular, but I think a lot of folks value what you're doing, and we know that we're asking a lot right now moving forward. And so just wanted to start off by saying thank you. You know, when we started back in the fall, moving forward with around 30% face-to-face and 70% online, we did that knowing that we would be dealing with COVID this fall, that we would have cases, that we would need to work quickly to isolate and quarantine and do a number of things to try to protect all of us as we move forward with this semester, but that it was something that we would have to navigate. We also indicated that if things didn't go well, or we need to pivot based on the landscape, that we would be prepared to do so. We did that on a couple of occasions by moving most of our upperclassmen courses online initially, but then pivoting 2 weeks ago, right after Labor Day, to all undergraduate instruction moving online. As we indicated on Wednesday, we believe, given the trends and all of the metrics and data that we're looking at, that it's appropriate to resume those in-person classes that we started out in person this semester. So beginning Monday, September 28th, our Morgantown campus will resume in-person undergraduate classes. The same percentage of courses that were conducted in person when we started will be again for the semester. And again, that should happen on Monday, September the 28th. Now, as I indicated, the university and Mon County health experts have looked at a number of factors that led us to this decision. Our positive COVID tests in the county are trending down, as is our RT rate, and I'll walk through that. The daily student positive cases are down at the university, including those that are conducted beyond the WVU system. We've seen consistent declines in student quarantines and isolation cases, and our occupancy level at Arnold is something that is sustainable. Additionally, and while this is a lagging indicator, it is an important one. Local hospitalization rate is low and includes no students, and we're not aware of any faculty or staff. Additionally, we are committed to continued transparency from our data and what we review as important, and that daily dashboard is updated weekly at 2 p.m. So let's walk through some of the data that was important to this decision for unpausing for Monday. So the chart that you have in front of you are all of the Morgantown student daily combined positive cases. So this is not only the test that we're doing at the rec center, but if a student tests positive at their own PCP, their primary care physician, or they go to a Med Express or somewhere else to get a test that's reported to the local health department or self-reported by the student or to the state and then traced back to Mon County is on this chart. So this is not just our testing, but a comprehensive of every student test positive that we are aware of. And again, that includes data from the local health department and the state. So what you see is through our re-entry testing, a relatively low level of infection for the first couple weeks. What you then see starting around August 28th, moving towards September the 1st, is a dramatic increase in those cases represented by the yellow bars for the daily positive rate. Now, one thing I want to note, you'll see 75 one day and 20 the next. That is a reflection of tests come back on different days, labs get to our tests at different points in time. We don't do as much testing on the weekend. And so while the dailies are important, the trend is something that we view as critical and our public health experts have told us to review. So you can see walking up towards Labor Day, we see a pretty significant increase in that trend. And since that time, the positive news is that we've seen a declining trend. We have not seen a significant day of positive tests. I can tell you that yesterday we resulted 370 tests and we only had 8 positive, which is a positivity rate on campus of 2%. And so you see the downward trend over the past 2 weeks, but the past 5 or 6 days of a continued decline of positive cases. Now, we think that's the result of several things. We think we've seen a change in student behavior given some of the activities and punishments that we've levied for those who violated isolation and quarantine. We think the actions of the city in cutting down on house parties has made a difference. We do think less activity on campus has added to that, although we think the classroom, as we'll talk about here in a minute, is a safe place as it relates to potential exposure, given the data that we know of at the moment. But nonetheless, the important thing is the number of positive cases we're seeing per day is on a pretty decent downward trend. It's not eradicated, but it is on a good downward trend. A couple other ways that we look at that is our isolation cases. So this is a chart that shows when we put students into isolation. So this is not only for Arnold Hall, but this is for all the isolation on campus. And by the way, I just want to note, I know that for K through 12, the state is considering Arnold Hall as a congregate setting, but those are positive cases for our campus. And so all the data that I talk about today includes a 1-for-1. So if there's 75 individuals in Arnold, there's 75 positives on the chart or whatever that day is. So the declining trend that you see includes all of our cases individually as positive. It's a separate question for K through 12 risk management that we could talk about later. So anyway, for isolation, there's a couple things that this story tells. One, it tracks the number of positives. But if you isolate and you are asymptomatic, which most of our students have been, you get out of isolation after 10 days. And if you're symptomatic, you get out based on what your primary care physician or student health indicates after symptoms have subsided. What you can see here is that most of our students are coming out of isolation after 10 days. I indicated before, we're not aware of anyone hospitalized because of COVID symptoms from a student population at this moment. Not to say that may not ever happen, but we haven't seen it yet. But you can see that the isolation numbers have trended down fairly significantly. We see a similar story with quarantining. Now, and Jeff, I will speak to this later, I'm sure, during questions, but I will say that our quarantining from a contact tracing perspective has been effective in identifying those who were close contacts and subject to a potential exposure. our positivity rate right now is around 6% overall for testing. It has been for a couple of weeks. For those in quarantine, that positivity rate's around 18%. So what that's telling us is those that we are quarantining because they were a close contact probably were exposed to some extent for those cases because they have tested positive at a higher rate. So our quarantining, we think, while it has been taxing at times, has been successful in helping to reduce the spread. And you can see that over the past 10 days, as we've seen a decline in isolation and positive cases, we've also seen a decline in quarantine. So that was just our student testing. We are very pleased that our faculty and staff testing, we've had very few positives. Since August 19th, when our earliest classes began, we've only had 4 faculty and staff positive cases. We are unaware of any positive results from a classroom exposure. Now, that's for a faculty and staff perspective. That's not to say that there haven't been, but we're unaware of any positive cases resulting from classroom exposure for faculty and staff. Again, we think our protocols of mask wearing, reduced density, plexiglass, and other measures have been successful in that the spread that happened amongst our students has not translated over to our faculty, our staff, or our community at large. So in addition to the raw numbers, we also spend some time looking at some ratios. This is a look at what the Harvard model that folks often talk about, as well as a little bit about the state model. So this is the Mon County positives per 100,000. On this chart, the blue line indicates the state, the green line represents Morgantown, and the red line indicates Monongalia County. So a couple of things to note on this. One, we're on a downward trend, which is great news. But then secondly, for our community's perspective, you'll also note that the rate of positives for this tracks our students. We are not seeing significant community spread or a number of positives outside our student population at this point in time. The RT, the rate of infection analysis, which I will just say in sum that if you are above a 1 from an R naught or an RT perspective, that means the virus is spreading at a greater than 1-to-1 ratio. If you're below 1, then it's spreading at less than a 1-to-1 ratio and is indicative that the infection is not spreading. So you can see on this chart, and again, the blue is the state line, the red and the green are Morgantown and Mon County. So you can see that when we had the spike in our student cases, we saw the RT value go up well above 3, indicative of high spread. But the past 10 days, the RT value has dropped below 1 and at a much better level for our campus. And so we see that the rate of spread in Mon County, in Morgantown, which is primarily our students, has declined significantly. I mentioned this before, but our weekly test results also track, and this is an overall positivity rate. So this is the number of positive tests compared to our total tests that are given. Now I want to note that this is just Q Labs and Quest, our testing that we do internally, because we do not have visibility into how many tests total external health providers do. We know what we believe we know what positive cases they get, but we don't know total tests. So this is just indicative of our testing. The other thing I'll note is you do see a very low rate of positivity for the run into campus. And we were doing a significant amount of asymptomatic testing at that point in time. The past couple of weeks, we've been testing those who are symptomatic, those who are in quarantine, or perhaps those who are at higher risk of exposure, like in our residence halls. And so we did expect that the rate of positivity would go up. We hoped that it wouldn't go up to the 12% we saw a couple of weeks ago, but we knew it would be higher than 1% or 2% because who we were testing was very different. Again, here's just another reflection of the positivity rate from a testing perspective. And again, you can see that so goes our student exposures have gone to university with WVU, Mon County, Morgantown, and the state from that perspective as well. One of the things that we also look at is our capacity to handle positive cases. So what this chart shows you is how many of our beds in Arnold apartments are occupied. Right now, that's around 45%, and so we do have capacity if there are additional positive cases on campus to ramp up to take care of our students and isolate them away from the community. Additionally, we've just entered into a lease with the owners of Gaskins Hall, which brings an additional 70 beds if we run out of space or it gets too much of an occupancy, too many folks in Arnold that we need more beds, we can open up Gaskins Hall. And so when you combine the 160 beds at Arnold with the 70 beds at Gaskins, we're only about a third of 30% capacity from an isolation perspective for our residence halls. We also look at the state data. A couple of notes, and I'll focus in on this middle chart. You can see that the daily percent of positive cases over the last 2 weeks for the state has seen a definite uptick. Through late July, early August, and early September, a really low positive rate of around 1.5 to 2, a little bit over 2%. Past couple weeks, and in particular, while some of our rates have been declining, we've seen positive rates for the state and a number of increasing cases across our state while our numbers have been declining. We also, one of the metrics we look at is our PPE inventory and capacity. The good news from this perspective is we do have a stable inventory of face masks, both medical and N95. We have hand sanitizers, we have cleaning supplies, thermometers, stanchions, spray bottles, and plenty of face shields. And our vendors tell us that the market is performing adequately to where if we need additional supply, we can get it. I want to spend just a couple of minutes talking about expectations and testing opportunities. So while we think it is appropriate to unpause, one of the things we indicated to all of our students yesterday in our campus conversation is that students, faculty, and staff need to continue to follow the safety and health protocols to ensure that we can continue through this semester. It is our goal to be face-to-face as we unpause through the remaining 7 weeks to get through Thanksgiving, and we need everybody to continue the protocols that have been, we think, on campus, effective in reducing spread, combined with the activities that we've taken from off campus to hopefully navigate these next several weeks. We also want to indicate that we are ramping up testing, and I'll get to the university testing here in just a second. But there's free community testing that's going to be available at the Student Rec Center every Wednesday for the foreseeable future. That's not only for the community in Mon County, it's for all WVU students, employees, and residents. It's not necessary to have COVID-19 symptoms to get tested. If you have COVID-19 symptoms, we encourage you to contact your primary care physician and work through them for a test. We also want to note that if you're asymptomatic and you're just getting tested, to get tested, you're not required to quarantine until you get those test results. We again encourage you to wear your mask, social distance, and be smart as we work through this pandemic. Our testing capabilities are growing significantly as we move forward. So there was a big push when all the institutions across the state came back, and our testing turnaround times were 3 to 4 days. That has improved significantly. Testing turnaround times are now running 24 to 48 hours. Both labs are working well with WVU, and our athletic testing has been going well as well. You should know that we hope to increase our screening and surveillance testing as we move forward. A couple of reasons for that. First, we are close, hopefully within about 3 weeks, of our Health Science Center and WVU Hospital standing up our own internal rapid response testing. It's a PCR-based test. The state of West Virginia gave us a $3 million grant, and we'll have the ability to run between 750 and 1,000 tests a day for PCR-based testing. Now, some of that, because the state has paid for the infrastructure, will need to go to help outbreaks across the state, but a lot of that testing we can use right here at WVU. And we'll layer that in, not necessarily as a substitute for the Quest and QLabs testing, but for additional testing capabilities for our institution. Additionally, we are working on and negotiating with a provider for antigen testing. So the antigen testing is not PCR-based. We believe at this point that there is a high rate of sensitivity for these tests, and we hope to have several thousand of these tests a month up and running within the next 10 to 14 days. And these are tests where you get the response within an hour. Now, these won't be generally available for everybody. We'll deploy them in specific instances moving forward. Just 2 other points relating to testing. WVU experts at our Health Science Center have been working to test wastewater coming from our dormitories, and we are using the evidence that we get from that wastewater testing to oversample residence halls, which are showing a potential for higher rates of infection with students. We're also investigating new testing that's coming onto the market and more readily available that is saliva-based, and closely watching what's going on with Abbott and other capabilities as we seek to ramp up our testing. The more we test and the quicker we get those test results, the better we are from a perspective of reducing spread, doing effective contact tracing, and getting into isolation and quarantines. So one final point. It is almost flu season, and we want to stress that it's critical for you to get your influenza vaccination. We are encouraging all of our students, faculty, and staff to get their flu shot this fall. Drive-through flu vaccination will be available, so students, employees, and employees' dependent family members and retirees who are residents of Mon and Preston counties can receive drive-through flu shots offered by WVU Medicine at the University Town Center Clinic now through Saturday, November 14th. Note that the drive-through is by appointment only. You can call 855-WVU-CARE. Again, that's 855-988-2273 to register. Please make sure you register if you're going to go so we don't overwhelm our colleagues at WVU Medicine. Additionally, we will be offering on-campus flu vaccinations. Students, faculty, and staff can receive their flu shot on select days beginning Thursday the 8th through Friday the 20th at the WVU Student Rec Center. Availability will be limited, and you'll need to register in advance for your preferred appointment. Registration will open next week, so stay tuned to UNews and eNews. And with that, Sharon, I will kick it back to you.
All right, thank you, Rob. So we're now going to move to the Q&A portion of today's discussion. And just a reminder to use the Q&A function at the bottom of your screen if you have a question for our senior leaders. If your question does not pertain to today's topic, we will hold that for another conversation. We'll also be identifying trending topics and frame questions that summarizes the interest. So that means not all live questions will be asked verbatim, but the topic will be addressed. And while we may not be able to answer every question today, our moderators will continue to answer questions via the typed response in the Q&A tool. So as we get our questions from the live audience rolling, I'm going to turn to a few that we received via email yesterday. And Rob and probably Dr. Coben, this first question is for you. They ask, why are we confident that when we bring students back to campus, things will be different? How are we better equipped to mitigate future surges of the virus?
So one, we think the positive trends are a really good positive sign. I think second, we think that the classroom has been a relatively safe space given the data. Third, as I indicated, there has been a significant effort by the university, including suspension of students for a year who violate isolation and quarantine. What I can tell you is we believe that we've seen a change in student behavior, particularly with the city's ban on social settings, house parties in key areas of town moving forward, that we think that it will be different from that perspective going forward. A couple of other things I'll highlight: the ability to test and get those test results at a quicker pace. And we have learned a lot through the first few weeks from contact tracing, isolation, and quarantine to where we think we are well and better equipped to navigate when those positive cases are. The other thing I'll mention, Sharon, is that there have been two instances I'll point out. So the University of Notre Dame and the University of Illinois at Champaign-Urbana both took 2-week pauses. If you look at their metrics, and we pulled up the University of Illinois earlier this morning, they saw the spike just about the same time frame as when they brought their kids back. So it was about a week, 10 days earlier. They did the same 2-week pause. And if you look at what's happened afterwards, they have not seen a second spike going forward. So we think that based on those facts, that we'll be able to navigate this next 7 weeks. I will say, we know there are going to be positives, and we know we're going to have to work together. So that's why it's incredibly important to wear your mask, use your plexiglass, and social distance. So Jeff, I don't know if you have anything to add, but kick it over to you.
Thanks, Rob. Very little to add. Actually, I think you covered the major points. Our ability to enhance and increase our testing capabilities, I think, is an important consideration. What we've learned through our collaboration with the health department in terms of both the case investigation and contact tracing efforts, and our expansion of our contact tracing team are important considerations. And I think finally, as you mentioned, the enforcement procedures that were put in place for what we saw occurring off campus. One of the things that most concerned me around the Labor Day weekend was the evidence for what we saw that was occurring off campus and had the potential to convert to what we would call a super spreading incident. And I'll talk a little bit more about those maybe later in the session. But I think that what we have been able to do is to avert a super spreading event. And because of that, I'm confident that while we will continue to see cases, as long as we can avert those type of events, we'll be in a good shape for the rest of the semester.
All right. Thank you, Rob. And thank you, Dr. Coben. And Corey, I'm going to ask a question that was sent in that really picks up on what Jeff was just saying. And they ask, if the majority of spread was occurring off campus, how confident are we that we can better manage off-campus activities that led to the spread, which led to the temporary shutdown?
Well, thanks, Sharon. So, I mean, I personally, I have confidence in the change behavior that Rob and Jeff have spoken about. I'm one of those people that I'm constantly watching students. So on Thursday, Friday, Saturday nights, and other nights throughout the week, I'm out at 11, 12, 1 in the morning, driving around, looking in the student neighborhoods, and just observing what student behavior is. And I can tell you that not just late at night, but during the daytime hours, I'm seeing more mask wearing by our students since we've taken the pause. I think they got the message that they want to continue with in-person classes. They wanted to resume that. And so as several said, the behavior's changed. And again, in partnership with the city, with their order limiting social gatherings in the Sunnyside area and that area around North High, Spruce, Willie, Falling Run area, that's had an impact. And again, the strong statement that we made and actions that we've taken against some students, including suspensions and expulsions. So I'm confident that our students' behavior has changed and will continue to change.
All right, great. Thank you, Corey. Marianne, this next question is for you, and they ask, if a faculty member doesn't want to return to the classroom and would like to remain online, is that an option?
Okay, thank you very much, Sharon. First of all, let me just echo what Rob Alsop said and how much the university appreciates what our faculty and instructors are doing this semester. You know, it was one thing to say in theory that we were going to be having to go, be adaptable and change on a dime. It's another thing to experience it in real life. And I was a faculty member for 11 years in the classroom with a fairly significant teaching load. And I mean, I can only imagine how difficult this has been for our faculty. And again, I want to echo Rob's sentiments about how much we appreciate your efforts. The short answer is to your question, Sharon, is no. We made a commitment to provide instruction to students in a particular format. Courses were designed for that delivery format, and we need to honor that commitment. But I want to reiterate that, the evidence strongly suggests that the classrooms are safe for our instructors. We have enabled faculty, I mean, it's federal law, but we've done this to apply for accommodations if a faculty member feels that he or she has a health reason for not being in the classroom and or is living with someone who is immunocompromised. And so we honored those accommodations, and I want to say we're pretty generous compared to some of our other competitors. And then, the last thing I want to say is that, we just, again, really appreciate our faculty being there. We told our students they need to come back, and we need our faculty to come back. And also just realize we have a very small number of courses that are being offered face-to-face on our campus. And so, this is a small number of courses and a small number of students and faculty.
All right, great. Thank you, Marianne. So I'm going to stick with you for this next question. And they ask, some of the students in my in-person classes have reached out and want to remain fully online. What guidance do you have in terms of communicating with and accommodating these students?
Yeah, sorry about it. I lost my video for a minute. So I'm going to give an answer that's pretty similar to what we said to the students yesterday. who are on our campus conversation, and that is that just as we expect faculty to return to the classroom, we expect our students to return to the classroom. Again, these courses were developed with a particular mode of instruction in mind, and they need to be delivered in that format. And so what I would say to you is that if a student has, again, a health issue, a major health issue, they can go through our Office of Accessibility Services and request an accommodation, which may mean that they can take courses online, but the professor is not obligated to deliver to a student online to a student who has chosen not to return to campus. And then finally, if a student is really pressuring the faculty member, I would refer that student to the department chair. And really that should be handled at the department level. The faculty member shouldn't feel pressured to make that decision.
All right, great. Thank you, Marianne. I'm going to stick with you for this next question as well. They ask, will instructors be updated on students who are supposed to be in quarantine since we're returning to campus? I have not received any notifications since we moved online 2 weeks ago, and I'm feeling a little bit in the dark regarding which students are and are not supposed to be in my class on Monday, especially since one told me this morning that he is in all departments, and I would have had no idea unless he reached out. So how will instructors be notified about students in quarantine?
I'm actually going to, I think, pass this one to Rob because this is an issue about contact tracing and notifying faculty, and we have a whole incident command center that is designed to do that. So Rob, is that something you'd be comfortable answering?
Yes. So I honestly need to check, but I will commit to you that we will have everybody notified as to quarantine and isolation for Monday. For those coming back to face, we'll endeavor to work through that.
All right, great. Let's see, Rob, actually, I'll stick with you for this next question. They ask, if the classroom is a safe space, as your data is showing and you're claiming, there will be no accommodations for faculty to teach online next semester, correct? If it is safe, everyone should be back in the classroom.
So no, and so I'll reiterate a couple of things. We believe that our classroom is a safe space, but I cannot guarantee that there will be no exposures. And so unfortunately in this pandemic, there are shades of gray everywhere going forward. We are comfortable that the protections that we have in place for individuals to be in the classroom are appropriate. However, there are individuals who may have other illnesses or other areas of being high risk that we think as an institution we have a moral obligation to provide them an accommodation in addition to the federal requirements that we have. And so the fact is, while we feel good about what we've done in the classroom, those who do have those underlying illnesses or other things that would require them to be out of the classroom, we are still going to accommodate them.
All right, great. Thank you, Rob.
Marianne, can I add to that, Sharon, that there'll be an email going out soon reminding faculty and staff how to apply for accommodations.
Okay, great. So that actually may tie into this next question, and they asked Marianne, will faculty who do not want to teach in person next semester be forced to do so? Forcing some faculty to teach in person and allowing others an accommodation destroys collegiality. Further, it's not good for students to have a faculty member who is scared to be there. So can you address next semester?
Yes, I will do my very best. So we're just starting planning for next semester, and I'll talk about that in a minute. But again, we do have a process where faculty can apply for accommodations if they have a medical issue or if they're living with someone who has a medical issue. And again, we've been very generous in how we determine that. But I would say to you that the decision about who teaches in what mode is going to be largely handled at the college and the department level. We would assume that the chairs and in some cases the deans will work with the faculty and try to accommodate as best they can. But we are going to provide some guardrails and guidelines about what we think that we need to see next semester in terms of density, also the types of students that we want to ideally offer some face-to-face instruction to. But that is going to be handled at the local level. And, I think it's a matter of the academic units deciding what is the best way to provide instruction to those students and what is the curriculum demand. And so that's the long answer to that.
All right, great. Thank you, Marianne. Rob, this next question is for you, and they ask, in yesterday's conversation in response to the question about the governor's comments to WBOY, Rob said that the governor and health department have given the university certain guidelines about when they can have in-person classes. What are those guidelines?
So if I indicated that, I misspoke. So let me just clarify. The governor's office and the HHR and the State Department of Education have developed a county map of which everyone is familiar. For higher education institutions, we've had discussions with the state, with the governor's office, and with our own health experts. And we've identified a number of metrics that we are reviewing that we went through earlier today to make the determination as to whether we need to take additional precautions. And so it is those lists of those factors that we review on a daily basis: positivity rate, positives, PPE, the R naught value, that we review just like each institution reviews to collectively make a decision. So to the extent that I said that there was a hard and fast set of guidelines on each institution of higher education, I apologize. That was not what I was trying to say, more as these are the key data that we're going to review to make a decision. And we have had those discussions with the policy commission and others as to the appropriateness of the data we're reviewing.
All right, thank you, Rob, for that. And Marianne also want a clarification on the last day of classes. So they're asking, can you clarify getting through the next 7 weeks? If students are here until November 24th, isn't that 8 weeks plus 2 days? Is the last day in person still November 24th, or has that changed?
Yeah, and let me just jump in. That's my fault. I think I said the 7 weeks, so I apologize. Nothing has changed on that. It is 8.5 weeks. So Marianne shouldn't have to clean up for my toe stubbing. It's I should have said 8 and 2, and I said 7. So I apologize.
That's all right. All right, but we know it's still November 24th, and that's the important thing. All right, great. So Marianne, this next question is for you. They ask, what about support for faculty whose school-age children can't go back to MON schools yet?
So let me just say this: we recognize at the institution how absolutely challenging this situation is and has been for faculty and instructors, not just because of the the extra expectations and how how we're going to deliver our courses, but also because of the demands of home and childcare. And so our office is offering a number of things to support faculty around childcare. I want to urge faculty to go to, if you haven't seen it, to the Provost website under adjustments for COVID-19 dependent care resources for faculty. But just give you a couple of ideas of things that we are doing. We have a child care emergency relief fund, which allows faculty and instructors who have what we're saying, intense child care needs to get financial support to hire additional caregivers. We are providing some tutoring for through our honors program, paid tutoring for both faculty and staff who need somebody to sit with their students, once a week for a few hours. We have had a high demand for that. So far, 74 people have applied. We have a limited amount of tutors, but if we can hire more tutors, we will do that. We allowed faculty and instructors who had money set aside under the Mountaineer Flexible Benefits Dependent Care Flexible Spending Account Program. We've allowed those, if their money's left over, to be able to spend them this year. They normally get cleared out in May. And then, I think the big issue also is about the ability of faculty to be successful in their progression through the ranks. And so we are offering the opportunity for faculty to ask for an extension of the tenure clock based on having significant childcare responsibilities. We are asking our academic leaders to be flexible when it comes to service assignments and not to overload our faculty. What I'd say to you is we're really trying to do a number of things to support faculty who have childcare needs. I think the most important thing is that our academic leaders be as flexible as possible in working around these challenges.
All right, great. Thank you, Marianne. We've also had a comment if our speakers can speak up just a little bit when they're presenting or responding. We have some folks who are having trouble hearing us, so we'll just need to make sure we're speaking loud. So Marianne, this next question is again for you, and they're asking, will instructors be required to provide two versions of class instruction, in person and virtual?
Give me 1 minute. I want to increase my audio, okay?
Okay.
So give me 1 minute. Let's see. Okay. Okay. Hopefully that's a little bit louder. Is that a little bit louder? Yeah. Okay. I'm sorry. Will you repeat the question?
Absolutely. So they're asking, will instructors be required to provide two versions of class instruction, in person and virtual?
What we have said, unless a class is designed to be high flex, which is basically a course that is you're delivering instruction on two different modes at the same time. What we have said is that if a student is quarantined or isolated due to a COVID-related event, that the instructor is obligated to provide some sort of instruction to that student in order for the student to achieve learning outcomes for the course. It doesn't have to be verbatim. It's just making sure that the student gets the course content and the assignments and is able to keep up with the class.
All right, great. And one more question, Marianne, then you'll get a break. They're asking, as a follow-up to the question regarding classes staying online, is the answer different for high flex classes?
Well, I think, yeah, I don't think so, because high flex is, again, you're offering modes of instruction, both online and in the classroom for different students at different times. So I would say no. I mean, you still are going to have students who want to be present. And then you're going to have students who are online, and those courses were designed specifically with that in mind.
All right, great. Dr. Coben, I think this next question is for you. It talks about the process when students come off quarantine, and they're asking, do students need to present something to their instructor once they have left quarantine before coming back to in-person classes?
Yeah, I think that really similar to the question that we received earlier about notification regarding quarantine. And I know we had a process in place for that while in-person instruction was underway, and I would anticipate that same process occurring as we resume classes on Monday.
All right, great, thank you. And
I can
Rob,
also maybe just make a couple of quick comments, Sharon.
absolutely.
I'd appreciate that opportunity. Yesterday, when we spoke with the campus conversation, most of my comments were really directed towards students, and I focused most of my comments on behaviors and the kinds of behaviors that are going to be necessary to continue to have a safe semester. Today, in speaking with the faculty, I wanted to just make a couple of other comments that I thought might be helpful to the faculty. A week ago, there was, I think, a very well done paper published in the Annals of Internal Medicine. And I think we're going to provide a link to that paper for all the faculty. And the reason I'm referencing this is because the paper really spoke to the transmissibility and the transmission of COVID-19. And it is a very comprehensive review of those factors. What is important in terms of the transmission of this virus? And I think certainly for faculty who are in the classroom, that is a major concern. And in no way do I want to downplay that concern. I think this paper talked about the issue of aerosol versus droplet transmission. It talked about the importance of physical distancing and ventilation. It talked about the evidence or lack thereof around how spread might occur through touching surfaces, and when people are most infectious during the period of transmission. There are two major conclusions from this article that I would like to just kind of point out. The first is that while COVID-19 is certainly a serious infection, and it certainly is one that has high transmissibility, that it is not as transmissible as other forms of infectious diseases that we know about, for example, measles and other types of infections. What we have learned is through a number of studies that for people who are sharing the same household as someone who has COVID-19, that the rate of secondary infection in that household is approximately 19%. So less than 20% of people who actually share a household with someone that has COVID-19 are going on to develop a secondary infection or a secondary case. And I think that that's important to keep in mind. The other thing that this article points out is that approximately 10% of the individuals with COVID-19 are responsible for 80% of the secondary cases of COVID-19, which means that there is a subset of the population who are these super spreaders and have these super spreading events. And the characteristic of those super spreading events is that they generally occur in closed environments where people are in close contact without masks for prolonged periods of time. And there are several exemplars that are listed in the paper. So I just think that it's important contextual information for our faculty and staff to have available to them. And I would encourage everyone to take a look at this. I really do think it is state of the art. And I think it also ties back to many of the things that were said earlier in this conversation about how we've been able thus far to avert super spreading events and also how we've been able to avert the spread in our classroom environments and other buildings across campus. So thanks for that opportunity.
No, absolutely. Thank you, Dr. Coben. And I know we've pushed out that link too, so we encourage everyone to go and check out that information. So thank you. Okay, let's go to the next question. And I'm going to turn this one to Rob. And they're asking, if there is a spike in cases comparable to the first one, is there a plan in place? Is there another 2-week break? Do we flip back to online? Flipping between online and in person is difficult for students and faculty alike.
So I'll just reiterate, our goal is to make it through until the 24th, be clear, the 24th of November, when our in-person classes were previously scheduled to end. And we believe we have a plan in place to do that. Just like what we'll do going forward is we'll look at all the data and the metrics going forward to make a decision for what we need to do. We're hopeful that we won't see a similar spike. And again, I don't want to, there's not a bright line of, during this COVID, we do different things, we learn more, we evaluate the levels on the ground and talk to our public health experts. And so we'll make the same evaluation of, has the level of spread gotten to the point that we think it's unsafe to have the level of in-person classes that we do, considering what we think we can handle and what our student behaviors are and the metrics we walk through today. And that's the threshold that we've looked at as a management team going forward for that. And so, we will look at those metrics based on the data in the ground. And there's so many different factors, it's hard to give a bright line for that piece going forward. So if there's a day where there's 70 cases and then a day of 20, that doesn't necessarily mean, like we did after the Labor Day split, that we would definitely say, oh, we've got to go back online. It's going to be a multifaceted approach. The second thing I will say, though, is if we do get to that point where our public health experts and as a management team, we think that our in-person instruction needs to halt, we know that that'll be a decision to go online for the rest of the semester, because we can't ask you to go and come back and go and come back. And so if we do get to that point again, it will be for the rest of the semester.
All right, great. Thank you, Rob. Corey, this next question is for you, and they're asking, could you elaborate on a student and the isolation protocol? So for example, do students complete a log if they leave the residence hall? Are campus resources brought to them? And if so, what resources and how often? So can you talk a little bit about how we take care of our students who are in isolation?
Yeah, sure. So I'll focus on sort of the two different areas, those that are on campus in the university residence halls, and then we'll look at those who are off campus. For those in the residence halls, as soon as we find out that a student has tested positive, and that can come through testing at the rec center, or that could come from a student who self-reports that to us, we immediately put into place a protocol that we isolate that student first by making sure that student stays in place in their residence hall room and masked up. But then we work to immediately move them and some of their belongings over to Arnold Apartments. And so we provide transportation for them, and that transportation's the driver's protected. But that student is transported over to Arnold. They check in at Arnold, and they're given, I'll say, a welcome pack of items to get them situated. We make sure that the room's provided with sheets and towels and things like that, that they don't have to worry about that. There's a TV in the room for them. We also have Wi-Fi available to them. And then we connect them up to make sure that they feel supported. We have a nurse that's available to them in Arnold Apartments that they can go and visit if they start to feel symptoms. Some of them are symptomatic, some are asymptomatic. And we've got some activities for them in the residence halls. We begin to deliver food for them several times a day. Plus, food and drink is always available to them with snacks and other things throughout the day. So even if outside meal times of hot meals, they want snacks, we've got that available to them. For students with different food allergies or food needs, we accommodate that obviously and make special meals available, whether they're vegan, vegetarian, or just want good old comfort food of hamburgers and hot dogs and French fries. We've got that available to them. And then they've got the opportunity to go outside for fresh air, and we do monitor that. They have a card swipe where they swipe in and swipe out. And then we also have obviously staff that are there that are monitoring them 24/7 that they've got access to, that are making sure that they're physically distancing, for example, when they go outside and get fresh air, but then also monitoring them inside the building, and again, available to them 24 hours a day should there be a need in the middle of the day or the middle of the night or on the weekend. For students who are living off campus, and let me take a step back and say for all students, we have the care team that reaches out to those students and is speaking to them and supporting them. So for those students who are living off campus, the work with them is a little bit less intense because the students typically have apartments and they're able to isolate a little bit differently and often have their own private bedroom. But our care team does reach out to them, support them to make sure that they know that if they're having any food needs, how we can help them get food delivered to their apartments or to their houses, wherever they're living. Similarly, if they need assistance in getting medicine, over-the-counter type medicine delivered to them, we know that the drugstores around the city that will deliver to our students, whether it's on campus or off campus. And again, our folks at Student Health are always available to those students to help should they start feeling any symptoms or anything like that.
All right.
Is that good?
That is, yep, great. Thank you, Corey. This next question is for Marianne, and they're asking what percentage of courses being taught in person are being taught by less institutionally protected instructors, such as TAPS, adjuncts, and pre-tenure faculty, versus those being taught by those with tenure? Are non-tenured folks carrying the heavy in-person teaching load?
You know, we were very concerned about that early on. And in fact, our assumption was that was the case, but in fact, it is not. So we actually have a breakdown in the number of classes, the percentage of classes being taught by on campus by tenure track versus non-tenure track. It's almost identical. So in fact, 18% of I'm going to make sure I have my data right. I think this is right. 18% of the on-campus. I'm doing my math wrong. I'm going to have to come back to it, but it is in fact. Sorry, it is in fact almost identical. I can assure our faculty of that. So in fact, tenure track and the non-tenure track, including graduate assistants, everybody's carrying about the same load.
All right, great. Thank you, Marianne. Corey, this next question is for you, and they're asking, is there any response to the list of demands released by anti-restriction students or the Save WVU March set to happen later today? It seems like these students are dangerously unaware of responsible practices.
Yeah, thanks, Sharon. So first of all, like, as the students demonstrated it in that post, I mean, we're all tired of sort of following those guidelines, but we're still in the middle of pandemic. And so we're not going to be able to relax some of the things that they're requesting, where in effect, they're asking for everything to go back to normal. But there are plenty of things, and we'll be responding and have sent an initial response to the student, and we'll be following up with another response. But some of the things that they've asked for example, the resumption of WVU up all night, the accessibility to testing and things like that, making masks available to students. Some of those things, for example, we'll be having conversations with our public health folks about the resumption of some of those activities that we were able to offer safely before we took a pause. But our initial goal was to get students back into the classroom. And now that we've gone back to where we were at the beginning of the semester, now we'll start looking at some of those other activities to make those available to students when we can do it safely. But again, for example, dining services is open. They've asked for masks for students. Those are things that are already available to students. Access to testing, again, I think Rob mentioned earlier that testing now is weekly available to anybody in the, at the Student Recreation Center on Wednesdays, and so we'll continue to have those conversations. But we're going to do it safely because we are still in the midst of a pandemic, and we're not going to take any chances to do something that would be foolish on our behalf. But I appreciate the question.
All right, great. Thank you, Corey. Rob, this next question is for you, and it's about availability of classrooms. They write that physical distancing is important for students and faculty safety. There are many larger classrooms on campus that are closed for this semester. The classroom is locked with a sign stating it cannot be used or entered, while smaller classrooms are being used for face-to-face teaching instead. Why not use the larger classrooms and allow students to have more social distancing between desks to increase safety?
So, I'll have to check and report back on that one. I know that the provost office worked with the planning team in my unit to go through from a comprehensive perspective across the university and look at finding the best fit for the classrooms. And so it may be that there's a better fit somewhere out there that they didn't get, looking at the dozens and dozens of classrooms that we have. And so what I might suggest is give me the opportunity to chat with the provost office, and our team could take a look. That might be something that you need to work through with your department chair to work that through going forward. We can follow up with the provost office and look and see if there's any adjustments that we could make. We're certainly not opposed to providing the best classroom resource for working this through. And again, from a global perspective, that was where we were intending to go.
And I would add that we had worked with our facilities people on making sure that the classes enabled appropriate social distancing, and that I think some of those larger classrooms may be used periodically for study space for students, or space where they can access their online classes. But I agree, if we need to make adjustments, we can do that.
All right, great. We're almost at our 11 o'clock hour, but we only have 4 questions left. So if our panelists are okay to continue, I want to make sure we get those in. So looks like I'm getting some head nods, so we'll go ahead and continue. Marianne, this next question is for you, and they're asking, are there any instances where a faculty member can make a decision to move a class online? For instance, if 30 to 50% of a class is in quarantine or isolation, can a faculty move the class online at that point?
Okay, so the answer to that is, I think it depends. So I want to answer this, in a couple of different ways. First of all, we, as I stated earlier, we don't want an instructor to arbitrarily make a decision to put a class online for the rest of the semester. Again, the class was designed for a certain mode of delivery, and we need to deliver on that promise. But that said, first of all, if you have a lecture class and you have a large number of students who weren't showing up, in essence, you can still lecture to those students who are in the classroom. If you have an interactive class that is smaller, and where really having 30 or 50% of students missing is, would actually impact your ability to teach a class, then you need to use common sense. You may need to cancel a class, or you may need to put one class period or two online. But I would suggest that you work with your chair and not make that decision arbitrarily.
All right, great. Thank you, Marianne. And this next question, I'll stick with you. They're asking, what actions would be taken if an instructor tests positive that is teaching in person or is required to quarantine? Would they be allowed to teach the class remotely while under quarantine?
I don't have the exact answer, but my assumption is yes. I mean, we don't want that instructor in the classroom, and we want to be flexible with our faculty, just like we're flexible with our students.
All right, great. And Rob, this next question is for you. They're asking, will the city's ban on bars and social activities remain for the duration of the semester?
So just a point of clarification, so the governor shut down the bars, the city shut down on social activities in certain areas. Both by the city and the governor's office are indefinite. I know that there was a lawsuit filed against the governor over the bars, and the governor during his press conference on Wednesday indicated that he believed he made the right decision and was forging ahead. I have spoken with the city manager this week to thank her leadership and for the city council's leadership in taking that action. After a little bit of complaints the first couple of days, I think by and large that's been successful. And we've asked them, I've asked that I've only wanted to go through till graduation. So, but they've given no indication that they're going to reduce or eliminate on either of those points.
All right, great. Thank you, Rob. And last question is for Marianne. They're asking, can we as instructors ask for documentation of positive COVID cases when a student notifies you that they've missed past assignments due to illness? So a student's coming and saying they missed assignments because they had COVID, can they ask for documentation?
I'm going to answer this to the best of my ability, and I may pull Jeff into this. So my understanding is that the instructor is notified or should be notified that a student is missing a class because of a COVID-related incident. We're not allowed to say they have COVID or they have been exposed, but a COVID-related incident, and then they should receive notification that the student is free then to come back to class. So I think that answers it, but I want to make sure. Am I missing anything, Jeff?
No, that's correct. And in addition, our student health services would be able to provide students with any necessary documentation if the student should request that.
Yes. And then the last thing I want to say too is just to remind our faculty that we do have the health and wellness survey that students are expected to fill out. We've had a fairly low percentage of students who have done that, but you may use the green pass that students have, that you get when you have completed that and show that you have no symptoms. You could request that in your class as a sign that a student is safe to be there. We're going to provide some instructions on how to do that. But I do want to offer that as another, potential tool for you in the classroom that would give you some comfort level that the students who are in the class, are well.
All right, great. Thank you, Marianne. So that concludes the Q&A portion of this conversation. And as we close, I want to remind everyone that we will continue to monitor the public health situation and will share information as quickly as possible. Therefore, it is critical that you stay current with information we are providing. So please be sure to check your university email account daily for any new information. You can also find the daily dashboard on the Return to Campus website, and we will issue a trends report weekly or as needed regarding our current COVID-19 cases. I'd also encourage you to follow us on social media, and in particular, the safety social accounts that you can find on Twitter and Facebook. And as always, everything you need to know about campus life during COVID-19 can be found at our Return to Campus website. An archived version of this conversation will be available on the Return to Campus website later this afternoon. And you can always continue to send us questions to returntocampus@mail.wvu.edu, and we will get back with an answer as quickly as possible. I want to thank all of our panelists who have shared their time and expertise with us this morning. And on behalf of our senior leaders, we appreciate you sharing your time with us today. So please continue to stay safe and be well.